Zach will also be recording this presentation, and that will also be provided to you all after this presentation as well. So if you would like to go back and listen to this presentation again, that will be available to you. And so my name is Cameron Hill. As Zach mentioned, I work with Chest Health as a senior customer success consultant. And really, I want to give you a little bit of an overview of who we are here at Chest Health. And so we are a digital health company that has a mission to address the individual and societal crisis of substance use disorder. All of the solutions that we're going to be talking about today and all the solutions we have at Chest Health are evidence-based solutions for the addiction management life cycle that goes from prevention, intervention, treatment, and recovery. We've worked with a variety of different stakeholders across the United States, including substance use disorder and mental health providers, health plans, state and local governments, and community organizations. You can see here that we've worked in a variety of different communities across the US, providing solutions specific to those community needs. So first, let's talk a little bit about our partnership with the Hancock County Adams Board. And so as Zach mentioned, we are partnering for e-recovery and e-prevention. And so one of those is the Connections app, which Mona is going to be spending some more time unpacking here in just a few moments. And I'm going to spend some time talking about the Hancock County Community Screener, which is paired with our e-prevention. And so those are two of the things that we have available for you all. But I really want to reiterate this point is all the resources that we're discussing today are free for individuals in your community. None of these are of charge for you. Thanks to our partnership with the Hancock County Adams Board, it's going to be free for you and for any individuals that you're working with. But really, to give a little bit of an overview of why this Hancock County Community Screener has been built to begin with, it's really based off of the principle of, wanting to improve and expand SBIRT. So for any individuals who are on here today who may not be familiar with SBIRT, what that stands for is screening, brief intervention, and referral to treatment. Likely, if you are connected to a primary care physician, you've experienced some sort of SBIRT throughout your life. It's a very popular, widely adopted prevention strategy to try and connect individuals to resources. But there are some issues and limitations when it comes to utilizing SBIRT. So one of the biggest things is that the screening is typically done in a primary care setting. And the biggest problem with that is, there are many individuals who may not be connected to a primary care physician or may not be connected to the medical system at all. And so those individuals are not being able to go through SBIRT where they're receiving that screening, brief intervention, and or referral to treatment based off of their substance use. Additionally, the screening may be limited in its effectiveness as it may be awkward, conducting that in an in-person setting. So the patient on their end, perhaps they may not feel comfortable answering honestly about their substance use directly with their provider, depending on their relationship. Maybe it's a new physician that they're interacting with. So they may not answer honestly, or they may be very brief in their answers, which doesn't give a whole lot that particular medical professional can work with. Additionally, when that provider is engaging with that patient, it can be awkward to ask those questions. It can be awkward to ask about an individual's substance use or alcohol use. And so because of those two things, it can make the intervention piece, so that BI, the brief intervention, maybe a little too brief. And so maybe, an individual talks about their alcohol use, and based off of the screening, that would be indicated as, maybe that's high risk based off of the level of alcohol use. And the brief intervention may be as simple as, well, maybe you should stop drinking so much. And so that's too brief. And that may come from just the uncomfortableness of, providing that screener in person. And the last piece of SBIRT, so the referral to treatment, it can be difficult to know what referrals can be made. So what providers offer certain services that may be of benefit to that particular patient. And so really that's why this Hancock County Community Screener was made. And so the result of these limitations for SBIRT is that too few individuals are being screened, as well as the screenings may not be as effective as they could be. And that also impacts the effectiveness of the interventions that are being offered as well. So the Hancock County Community Screener, it helps to enable more and better screening for alcohol use specifically. So this is based off of the audit, which is an evidence-based alcohol screener commonly used in the mental health field. But the benefit is that this is an anonymous screen. So this can be done completely online, and it's going to be completely detached from any healthcare organization. So the benefit of that is that individuals may feel much more comfortable to answer honestly, because they're not having that direct face-to-face interaction, to be able to get results that are catered better to them because of that. This screener also has a configurable rules engine, which really all that means is that as individuals fill out this screener, they're going to get interventions and feedback that are appropriate based off of the answers that they provide. So we have 3 categories. So it would be either low risk, moderate risk, or high risk to negative effects of alcohol use. And so based off of that, they're going to get different feedback and interventions that are going to be specific to them and where they currently are at. With those interventions, we're also going to provide a wide variety for them to utilize. So we're utilizing evidence-based interventions. We're providing content, web links. We're providing referrals to helplines as appropriate, as well as self-moderation tools, different referrals to treatment that I mentioned. So I'll talk through some of these individual pieces here in a moment. And as well, if they indicate that they're utilizing alcohol to a certain degree, they may also be prompted for a download link to the Connections app that Mona will talk about more here shortly. But again, really what the Hancock County Community Screener is meant to do is improve the amount of screeners that can be done, make individuals more comfortable to fill out the screen and provide that very specific catered feedback to those individuals directly in the moment. And so this is an opportunity to provide the screener in a variety of different settings outside of a healthcare setting. So in the community in general, for employers, schools, or health plans to be able to utilize this particular screener in Hancock County. And so that's really the overall goal of the Hancock County Community Screener. But I want to take a few moments here just to show you what this screener looks like. And so I can walk through a few examples with you. So I've kind of made my screen a little bit smaller, as majority of the individuals who fill this out are most likely going to be doing it via a mobile phone versus a laptop or a computer. So made the screen a little bit smaller so that you can we can simulate it being on a mobile phone a little bit easier. But you can see here, it's a very brief self-assessment. It's only 10 questions. They're going to have this prompt at the beginning that this is a 1-minute survey to give them helpful feedback on alcohol use. And I'll just scroll through here just so you can see what a few of the questions look like. But they're just going to go and click through any of these questions and it will filter down the list. Once they completed the survey, they're going to hit continue. And it's going to say that their results have been analyzed. And so going back to we'll look at first an individual who's going to be in this low risk category. And so some of the things that we're going to offer is some positive reinforcement, some links to some education, as well as perhaps if additional resources that may be applicable to them as well. So looking at the low risk, you're going to see here, we have this text at the very beginning. This is going to populate for every risk category, and talking about what are some next steps for them to be thinking of. And so for these individuals and for all of our risk categories, we're going to start off first with these quotes. We try and pick individuals who perhaps the community may recognize, but are just a little bit of positive encouragement for them on their road to recovery. But you will see here that we have several different resources for individuals to get connected to. So they can receive the resources a couple of ways. They can either click preview information here, and you'll see that they'll be able to click the links directly. So again, this is for low risk. So what they're looking at are what are some of the health impacts of utilizing alcohol? And so we have a link from the Mayo Clinic, the Healthline, and Forbes talking about the impact of alcohol use. If they would prefer to not preview the link, what they can do is click on this receive information button, and they can check if they would like to receive it via text message or an email as well. So both of those options are available. They would just enter their information and click send to show that. You'll see here, this is, for any individuals that screen low risk, but maybe are talking to children about alcohol use. And I want to call out specifically for each one of our groups here, regardless of their risk level, they're going to receive the Hancock County Recovery Resource Guide as an additional resource for them that will be in much more detail of all the options that are available to them locally. So again, they can preview that information or choose to have that information emailed to them. We also have built in a referral to the Hancock County Crisis Line. So if an individual is filling this out on their mobile phone and they felt that they were indeed in crisis, they can click this call button here, and this is going to immediately populate in their phone for them to call. We've also included the Family Resource Center and their crisis intervention and stabilization services as an additional resource for these individuals to be able to call if they need it. And so that's a little bit of an overview of what the low risk category looks like. I now want to take a few moments just to look at moderate risk. So in the case of this particular screener, the moderate risk is a little bit of a wider net. So there's a lot more scores that can fit into the moderate risk. So if an individual is kind of on the low end of moderate risk, they may get certain suggestions. If they're on the higher end of the moderate risk, they may get different suggestions based on those answers. But typically, we're going to offer encouragement, these self-moderation strategies and tools, as well as the helplines. And I'll walk through, this is what it looks like for the moderate risk. And so we have these quotes at the beginning, but we specifically have some additional tips on, how to cut back on their drinking. So this is for an individual who is not in a high risk category for alcohol use, but maybe in kind of on the higher end of that moderate risk. And so it gives some some tips as well as steps to cut back on drinking today. And you'll see some of these are similar to the low risk, but this is where we will see the suggestion as an optional suggestion to get connected to the Connections app. And so that's based off of this individual scoring high in that moderate risk category, where if they scored lower, this would not necessarily be an option that would come up for them. And then lastly, looking at the high risk. So this is for an individual that based off their answers would deemed as high risk for negative effects of alcohol use. That is where we're going to start to see more of this referral to treatment. And so looking at the high risk, you will see here, so we have a referral, and this is based off of their answers, a referral for an appointment with a doctor, therapist, counselor, or other healthcare professional is recommended. So for those individuals, they can click on the view local options. This is going to immediately default to Findlay, Ohio. However, they can search their specific address. And it's going to pull up providers in their area based off of their distance that can help provide some of that additional support to them. And so that is the option that's going to be available for any of those individuals that are indicate that they would be high risk. They're going to have the option for the Connections app, and that's going to move here to the recommended section. But there's also the option for if an individual feels like they need to be surrounded by a community of other individuals who are also in recovery and move to a more of a residential treatment option. That is listed here as an optional resource, but again, they can use this find a provider And that's going to show them any of those residential treatment opportunities in their immediate community that they can get connected to. When an individual hits search, it will show those providers, but it will also give them all the information on those providers that can be sent to their email or to their cell phone. And so again, it's really meant to help close some of the gap for these individuals to fill out a screener where they feel more comfortable, get some of that specific feedback, and then have a list of interventions that they can take following that feedback. And so that's really the overview when it comes to the screener here. I will show you here, we have a QR code as well as the link that will take you directly to the community screener. So I'd recommend everyone here, if you have a mobile phone, utilize the QR code to go take you to this link. Fill out the screener yourself so you can see a little bit about, how does it work? What is some of the feedback that is offered? But I'm also going to post the link here in the chat. So if it's easier for you to do it on your desktop, this is a link that you can do that's going to take you directly to that screener. Test it out for yourself, get familiar with it. But ultimately, after you test it out, so this is as simple as it is to share it. So just sending a link or showing this QR code is all individuals need to get connected to this resource. So again, this PowerPoint is going to be provided to you all. So I would just encourage you all just to be able to share this with any individuals or in the community for any individuals that could benefit from this free resource. And so with that, I will conclude my time and I'll hand it over to Mona to talk a little bit about the Connections app. If you have any, well, actually, Mona, real quick, let me pause here. Does anyone have any questions about the Hancock Community Screener before we move on to the Connections app?
I have a question.
Sure.
Are you tracking the data? So will there be like a metric, like how many people are taking the survey and maybe a spectrum of results?
Yes. So all of it is an anonymous screener. So we won't collect names or anything along those lines as far as data metric goes. However, we will know, how many individuals have completed the screener. We will know what the answers are. We will know if they refer themselves to treatment. So, all the buttons that were on that were the text in blue, so we will also know if they click for the crisis line, if an individual types that in and actually calls the crisis line from the results section, we will be able to track all of those specific metrics. Yes.
Hi, Cameron, you mentioned this for use in schools. What's the age range for individuals completing this?
So there's no specific age range. I will say, there are referrals to treatment. And so based off of that piece in particular, that may be where you definitely want parents' involvement in that piece when it comes to referral to treatment. But as far as completing the screener itself is absolutely open to everyone. And as far as the resources themselves, there's not anything in there that would be inappropriate for certain ages. However, there just may be things that maybe are less applicable. Like we have a parent section in that low risk category of, how to talk with your kids about, their alcohol use. So that may not apply necessarily in a school setting. But however, one thing I do want to note with this too is that the survey is customizable. And so if there's certain things that you're really interested in seeing, feel free to reach out to me. I'll also include my contact information and we can see if we can adjust things for you that would make it a better fit for you.
Okay, thanks.
And I'm sure you're going to get to this, Cameron, but I just, did the SBIRT, and then is there, and maybe I missed it, is there an option now where I could, because I don't have the app downloaded yet?
Mm-hmm.
So is there a spot after somebody completes that screen where they can just immediately, I don't see that on here, download the app?
So it depends on your risk level. So if the app is offered as an option for download, if an individual is moderate risk, kind of on the higher end of the moderate risk or high risk,
Okay.
So if you're on the low risk section, it's not necessarily offered as an option. So if it's moderate risk, it's going to be in the optional section. So it might be towards the bottom. If
Okay.
you are high risk, it will be in the recommended section, so a little bit closer to the top.
Okay.
And yeah, that will, when you click that link, it will immediately send you the link to download the app if you haven't downloaded it yet. And so that will take out a few steps for you to be able to immediately access the app from there. And you do need to be on a mobile phone for that download to work. So I will
Yep.
note that as well.
And that's what I didn't see the download option, because I did the QR code that you have up right now,
Mhm.
did the screening. And just, yeah, I don't see an option to download the app.
And are
But
you on your computer,
mobile?
mobile?
I mean, I'm on my computer now, but I did it through my mobile.
Okay. And what risk category were you in?
Low.
Oh, that's why. So it's not an option low. So if you retake it and place in the moderate or high, you'll see it as an option to download.
Okay, but I assume we'll all be able to download it
Yes.
to have
Yes.
it. Okay.
Yes, absolutely. Any other questions?
Hi,
There you
Cameron.
go.
Yes.
I just want to make sure that I'm saying this right
Mhm.
in the community. So I appreciate the screening. I'm thrilled to death that we have it. And that gets me to the app. Now,
Mhm.
let's say I'm somebody who's been in recovery for a long period of time,
Mhm.
or I'm done with my primary treatment, so to speak, and I want
Sure.
to use the app to help support my recovery.
Mhm.
I don't have to get the app through the screening. I can
Correct.
get the app directly,
Correct.
which is what I think Gary's, okay, so I understand that.
Absolutely.
Okay,
Absolutely.
thank you very much.
Yep. So yes, and Mona will talk through some of the different avenues that you can receive the app directly. It's not only available through the screening option. Absolutely. Thank you for that clarification, Brescia.
Actually, that's a perfect segue, I think, Cam, into to my
Absolutely.
part. So, yeah, so we're going to switch gears now and talk about the Connections app. And I want to reiterate what Cam said at the beginning of the presentation. So this is a free resource. It's provided to all Hancock County SUD treatment providers, recovery coaching organizations. They're able to offer this free to their clients. But I also want to mention that any resident in Hancock County that's in treatment or recovery, just as Presha had mentioned from SUD, they're going to be able to access the Connections app for free as well. They do not have to be connected to a treatment provider. Sorry about that. Okay, there we go. The Connections app basically is just an evidence-based smartphone app, and it's used to treat the treatment and recovery of individuals that are affected by substance use disorder, alcohol use disorder, and behavioral health issues. So with the app, individuals can access support right from their own back pocket, 24/7. It combines technology and certified peers. We call them the CHESS Peer Engagement Team, and it delivers that recovery support 24 hours a day, 7 days a week, 365 days a year. So every day we have thousands of individuals that are in the Connections community from across the country. And it can be used whether they're in early recovery, maybe while they're in outpatient treatment, maybe they are in medication-assisted treatment and aftercare. So the Connections app provides evidence-based tools and peer support. And what we find is that it improves that short and long-term recovery outcomes. So we all know, I know most of you guys are in healthcare, and you know that systems of care have really improved a whole lot. But it's not always structured in a way that's going to meet the needs of the individuals that we serve. And all too often we find that individuals relapse after starting treatment. So, change is hard, recovery is hard. So supporting individuals through a change like recovery can be 12 months or more. So often an individual will come into the residential treatment They may step down into intensive outpatient, move into outpatient, and then hopefully into aftercare. But what we find is it's really easy for individuals to fall through those gaps of the system. And sometimes that results in increased likelihood of return to use or possibly overdose or really other difficult outcomes. So supporting recovery is a 24/7 job, and that's where we come in. CHEST knows that clients often need help in those odd hours of the middle of the night, and that's where we can support them. So let's say a client's been discharged to outpatient treatment with an hour of counseling. When they leave that counseling appointment, it could be 168 hours before the next treatment. And so without a healthy support system in place, those hours can be full of risk moments. And we all know that most times when we go into treatment, we don't have that healthy support. So they're going to experience triggers, cravings, they're going to have relationship issues, and more. So that's where CHEST believes that technology, along with peer support, can really help those individuals stay strong in their recovery. We believe we can move the needle on those relapse rates. And although the Connections app has many great features, I do want to reiterate to you that its primary purpose is to provide recovery support to individuals. We really want to close that gap and help those clients when they can't be in treatment with you. So technology, as I mentioned, is really supportive. And what we have found and what really the evidence shows is that when individuals are not alone, when they have positive engagement, and they also have positive activities to participate in, those risk moments are minimized. And when they do occur, they have better coping skills to get through those tough moments. So, you know, when you look at the Connections app, it really is an app that's going to help your individuals stay in treatment longer. And we all know that if people stay in treatment longer, their outcomes are going to be better. And more importantly, their quality of life is going to be better. So there are a lot of different ways that the Connections app helps support people in their recovery. And I want to also mention that there's a lot of mental health content as well, because we all know that those issues go hand in hand. So in the app, individuals can access virtual support meetings. They can access immediate peer support. They can do recovery assessments, and they can do a whole lot more. They can do guided meditation. And there is also the option for providers, if you want to be involved, you're going to have the choice on how much you want to be involved in the process. And so you can even use the app to connect with your clients as well. So really, our mission is to meet people where they are. So what we want to do is make sure that they have the resources that they need to achieve long-term sobriety. And we're able to do that. I always say to people, you know, I'm in recovery myself, have been for 14 years. And what I always say to people is it's so much more than an app. What you see with this app is tremendous human connection. So at the heart of the Connections app is our team of certified peer recovery specialists. So these guys come from all different lived experiences. We have women in recovery who are mothers. We have people in recovery that have gone through treatment, some that have not. So they have lived experience, but more importantly, they come from all different pathways to recovery. We believe that there is no right or wrong way. There's any, there's all different ways to achieve recovery. So our peer engagement team moderates all the community discussions because we want to make sure that there's a safe, supportive environment. In fact, many of our clients have told us that they've gotten rid of their toxic social media and they use the Connections app as their primary source of connection. So during setup, all individuals are prompted to create an alias. That allows them to share anonymously, and our peer engagement team really does a great job encouraging clients to participate. And remember, those are moderated around the clock. Our peers will, they'll post topics all day long. They could be topics that range from just us SUD recovery. It could be mental health topics. Sometimes they'll post getting to know you questions, and then they also post a lot of fun things too. There's a lot of fun that we have in that app as well. And they are able to provide one-to-one support regardless of the time or location. Because we all know that it's often those odd hours in the middle of the night, maybe on the weekend, when those clients need that extra support. We believe treatment is the answer, but we believe that support when they're not in treatment can also move that needle and prevent relapse. So as I mentioned, our CHESS peers come from a variety of backgrounds. They have lived experience in recovery pathways, and their primary task is to moderate online discussion groups. But I also like to say their real primary task is to support individuals. Every day, one of my favorite part of my jobs is to come in and look at the Great Story channel, and we just see incredible relationships being built within the app. In addition to moderating the discussion groups, they host what we call alongsides. These are basically just video group meetings. Topics range from mindfulness to co-occurring, LGBTQ, family and parenting, and we even have Mary who does this really great Tai Chi for recovery. So there's just all kinds of support for clients. We've even found some of our clients that are in the criminal justice system are able to use the app and those alongsides to meet some of those requirements that they have to meet meetings. I mean, with COVID, we've gone back to normal in some cases, but I know my home group still doesn't have the number of meetings that they used to. So this allows people to, really once again, meet people where they are and they can attend those meetings at their convenience. So here's an example of communication within the app that really, I think this really illustrates the power of the Connections community. So TI asked, can somebody give me some things to do to help me get past the urges to use? I know that was something that was on my mind in early recovery. So within moments, one of our CHESS peers reached out with suggestions, and she let the individual know that she was there to help. And as you can see, the support just kept coming. So ultimately, the individual was able to connect one-to-one with CHESS peers and talk privately. So then, go ahead, Cam. And so then the next day, TIA was able to post, that important, I'm 60 days sober. So I think that just really shows how that support can be so key in those hours that clients can be alone. So we find that the peer engagement reduces social isolation, it teaches and reinforces coping skills, and it really, one of the things that's important in my own personal recovery is to help others. And so I think that's another thing that the app is able, we have people that come in and, maybe TIA, she was able to get that support, and then within a week, she's out helping others. So some of the other features of the app, there's a resource library that has videos, articles, TED Talks, meditation, but they also can engage in CBT for recovery lessons. So this is cognitive behavioral therapy, and it's right within the Connections app. The lessons are really engaging and they're very interactive. And what they do is really help the clients develop key coping skills, which of course always improves our outcomes. It's done with these engaging videos. It discusses topics, that you deal with in early sobriety or sometimes in late sobriety, recognizing triggers. How do you deal with those cravings? Stop. How do you stop and think about what the next step is? So, and it's also a great tool because you can really view it from the comfort of your own home, coffee shop, really whatever's convenient for you, and they can be replayed as often as you like. So as I mentioned, the Connections app has a large variety of recovery tools. It has an optional sobriety tracker, a reminder to journal, and that's private right within the app. And it also helps people to recommit to those personal goals and motivations. Go ahead, Cam. So you may have noticed that little life preserver in the lower right-hand corner. So this is what we call the recovery help button. I like to say it's like a pause button. So once pressed, the individual is going to be asked if they want to speak to a CHESS peer. So if they answer yes, a CHESS peer is going to reach out to them within the app, or they may even call them. They'll ask if they want to call. It also kind of gives you that pause for a moment, and we encourage people to put their contacts in so they don't have to go back out of the app. Once you hit that recovery help button, you hit that pause, you can either talk to a peer, maybe you call. I know for me, I have my sponsor and sponsees in my contacts, or maybe you can get relaxed and do meditation, or maybe you're really in a crisis situation and you can call the helpline. So basically what Connections does is it provides cues for individuals to stay on path to their recovery. So each day they are going to complete a daily recovery check-in. So it's just one question, and it asks them, are you confident you can make it through the day? If an individual answers no, our peer engagement team is going to reach out and offer that extra support. Also, each week, individuals are prompted to take what we call a brief addiction monitor survey. In this survey, they're going to be prompted to answer 13 questions. It's actually the same survey that we used in 2011 during our clinical trials. And it basically asks them, number one, whether they've used drug or alcohol in the last 7 days. It's going to ask them maybe to rate their urges. Ask them, have they had difficulty sleeping, the number of risky situations, relationship troubles. The surveys are then going to generate a graph chart that will show individuals their weekly progress. It's a great tool to not only see where you have progress, but also those areas where you need to work on. I know for me personally, it's like when I was in early recovery, I often didn't know how I was doing. And I love this because this is a way that you can see how you're doing in your recovery. We also have gamification, and really this just allows individuals to earn points and badges and share successes and encourage others. It's just a really great way to have fun and build skills. They can recognize their streaks. And once again, I mentioned earlier that a lot of people are using this as their social media. So you can even earn badges and post those on your social wall. And it gives people an opportunity to interact with others. You know, if you see somebody posted 60 days, they're able to go in there and encourage them. They can also share milestones such as recovery anniversary. And really, the gamification is just another way that they can have fun while they're participating in their recovery. So since I'm going to kind of slow down and close with this. Since joining CHESS, I really have loved the opportunity I have to see these miracles that happen and see how this technology and our peer engagement team really touches people. So this is a story about Persephone Moon. So she was a woman in West Virginia who was 41 days into recovery from an opioid disorder. And due to her addiction, she no longer had custody of her child. And she was really just having a rough time. She had downloaded the app 5 weeks earlier. Her provider had offered it to her. And she had been reading messages, but she had never really posted. And then on July 28th, she had a supervised visit with her daughter. 12 hours later, at 1:28 a.m., she was struggling to hang on. So for the first time, she shared. And she, I always really get when I see these stories, it really is such a reminder of how important this app can be to people. So she posted a really raw acknowledgement of the pain that she was in. And she was really questioning how she was even going to get through the night being sober. And within minutes, a CHESS peer read her post and responded immediately. And in the hours that followed, so did lots of others who are in recovery. As you can see here, we had people in the peer community that responded. Go ahead. And this is an individual, actually, Brett, who's been in the community for a while, and they're just able to come in there and just share their experience, strength, and hope. And I love this part. You know, now you fast forward, she got stronger and stronger in her recovery. In time, she married a great guy. She regained full custody of her daughter. And 8.5 months later, she gave birth to a healthy baby boy. And it turns out she was only a couple of weeks pregnant when she got through that night. So thanks to her hard work, the support of the app and the community and our peer engagement team, there's a strong, healthy family in West Virginia now where there wasn't one before. So I love sharing those stories. And, you know, as you work with us too, you'll see that that's one of the key things that we try to do is make sure that we share those stories with you and you see the action, you know, the app in action. Go ahead, Pam. So I'm also really excited to share that we just launched Conexiones. So that's going to be our Spanish version of the Connections app. It's been translated culturally. It's going to be supported by bilingual peers, and it's going to have the same 24/7 support and the same great features of the Connections app. So going back to the question that was asked earlier, I want to close by saying, first of all, that we're super excited about our partnership with the Hancock County Adams Board and you. I hope you've gained some insight into the benefits of the Connections app and want to know more about getting individuals connected. So the Hancock Board has provided information and quick access directly on their website. So in answer to the question earlier, if you want to download the app, you can go right to their website. We've made it really convenient. What you'll do is you'll just scan the QR code or click the quick enrollment link. This is going to bring up a very brief enrollment form. We just ask a few questions. That's going to trigger a text message to the individual's phone with a download link and a temporary password. And then they're going to be able to complete all the setup steps, and then they're in the app and they're able to get started. So I also wanted to mention too that, so we understand that there are a lot of challenges you guys face. So it may be that you want to just offer the app to clients. So you have the choice to do that. However, I wanted to let you know too that in addition to simply offering the app to clients, you can choose to provide extra support and engage with your clients. So the CHEST dashboard, and a lot of times you'll hear e-recovery Connections app. Basically, the Connections app is just part of the e-recovery platform. So as a provider, you have access to our CHEST dashboard in addition to the Connections app. So I am working with some providers now, and if you're interested in doing that, I'm going to give you my contact information, but we would love to talk to you more about how you can use eRecovery Dashboard to send secure messages to your clients. You can track recovery process. You can also view survey data, and a lot of our counselors can use this information as they see patients. So implementation is really quick. And we're going to be with you every step of the way. So we're going to provide ongoing support. But I just want to let you know that really how much you choose to engage is up to you. Once again, you can simply offer the app, or we can set up time to really teach you how to use the app and all of the great features it has for providers. So that's really all I've got. I wanted to take a minute here and ask if anybody has any questions. Awesome.
I don't have a question, Mona. I just want to make sure that we're clear that, you know, because of the pandemic and the increased use of alcohol, we really wanted the screening to be up there and available, and it targets alcohol. The app is available for anyone, irrespective of what substance is involved. So, you know, whether you've been in long-term recovery, early recovery, whether it's alcohol, opiate stimulants, it doesn't matter. This is an opportunity and an option that any of us who are working with anyone at any level can link them to as, again, another tool in their toolbox, not a replacement for treatment, not a replacement for the face-to-face peer support, but that additional support that we can offer someone that they can tap into whenever, wherever they are.
Thank you, Prescia. Very well said. Yes, absolutely. Any other questions? Well, we really appreciate you guys, but I want to also say I will be sending out, in addition to the slides, I'll be sending out additional emails. But if you're a provider and you feel like this might fit into your practice, please contact me because I'd love to get you set up. And even if you're a provider who wants to maybe just offer this to their clients, we can provide you with all the collateral to do that. So in addition to the QR codes and the quick enrollment links, we have some really nice collateral you could just keep in your office to hand to patients. So please, if you feel like that might be something you're interested in, please reach out. Zach,
Mona?
and thanks a lot, Zach, for letting us have the opportunity to speak today. I'm sorry, did somebody say something?
Hi, Mona. This is Jennifer Laura from Blanchard
Yes.
Valley Hospital. I just wanted to let everybody know that I set my women up with them with this app like 2 weeks ago, and they were so over the moon excited. Like all of them were just really hyped up about it. They were just really excited that it was a safe place. And you know, something I never thought about that they said was, you know, people go on social media, but there's certain things they can't share on social media without being judged or shamed or putting, you know, all of their dirty laundry out on social media. And so they were all really super excited to be able to join this community, that they felt safe and were proud to share different milestones that they were able to achieve.
Thank you, Jennifer. I love hearing that. That's awesome.
I think, I know you both said it. I just want to reinforce, because I know people get so afraid about putting information out on social media, myself included. You know, I just want to remind everybody that even though we're paying for this, for a grant, for the community, we're not getting names or anything like that. Like their information is not being used for advertisements, to get a hold of them, anything like that. The only kind of data we're getting is, you know, 60 people signed up, you know, so many were male, so many were female. Like there's no identifying information. And individuals can do this with and have a surname, you know what I mean? They don't even have to use their true identity in terms of if they're more comfortable to say, you know, I'm Lucy Liu, you know, versus Prescia on the app. So, you know, please help reinforce to everyone that none of their information is being used for any additional purpose.
Yeah, that's a very good point. We are HIPAA compliant. We also have high trust certification. So everything that's done within the app is done anonymously and it's done securely. So yeah, that's very important. And you know, it really is, it's just a really safe space. I love what you were saying also about not wanting to, you know, Jennifer mentioned about not wanting to share things on social media. I know sometimes I go on social media and just see all the comments and it's just, it's hard, you know, but here's a place where it's moderated. So if somebody does post something that's maybe off color or maybe just not really appropriate, we're going to talk to them, but we're going to give them an opportunity to grow. You know, we're not going to shame them. We're going to reach out and just ask them if they thought about looking at it this way or that way. So I think that's an important key piece that kind of sets us apart, is that peer engagement team that we have.
And like anything else, it doesn't work if nobody knows about it. So we all have to be good advocates, and Steve is taking the lead in our office to try and go through businesses, because a lot of our business owners are very cognizant of that people are struggling and that the pandemic has been difficult. And so they're trying to provide this as an option. So anybody that has an opportunity to help be a mouthpiece, please do so. Sarah, I see you got off of mute, so I must have interrupted you. I'm sorry.
Oh.
Maybe not. I
Maybe
usually
not.
see that as a cue, like, shut up, Prescia, somebody's off of mute.
Mona and Cameron, thank you so much for your overview. We really appreciate it. Like Precious said, if anyone needs any PR materials or ways to continue to advance this, please connect with Steve. I'll put his email in the chat right now for you. And direct access to the app and also to the screener is on the Adamus website. So please go to that directly, but we'll be sharing out the slides, which will have those links and the QR codes and also recording to this. So please share this with someone that may be interested, but wasn't able to join us today.
And a special thanks to Dr. Coast. This was your brainchild to say we need to get something more available to everyone, and to Dr. Flaherty, who helped us make connections. How's that for a word? Helped us get links. So thank you so much. We're thrilled to death to have this partnership and really looking forward to everyone's help.
We are as well. Thank you.
All right. Thank you, everyone. Have a great day.
Bye-bye.
Thank you.